causing the use of AstraZeneca comes as the country reaches a new all-time high of 167,000 active cases of COVID-19. This is 20.2% of the total COVID-19 cases in the country, which has reached more than 828,000. The World Health Organization has recently raised the alarm over the effect of the current surge in the country's healthcare capacity. It is urging the Philippine government to set up more temporary facilities for mild to moderate cases and to strengthen contact tracing efforts. And let's now check on the situation at the Philippine General Hospital. With us this morning is PGH spokesperson, Dr. Jonas del Rosario. Doctor, good morning. Good to have you on New Day again.
Hi, magandang umaga, Ria.
Doc, many in PGH, they've already received the first dose of AstraZeneca vaccines. You have received the first dose of AstraZeneca yourself. What is your reaction to the FDA recommendation to stop its use?
No, I think it's just prudent for FDA to just check on the data. Anyway, pretty much we have used all the AstraZeneca vaccines that we have. And the next dose will be about 3 months from the first dose. So that's sometime late in May for most of the people, or early part of June. So we have time to pause, review the data, check if we have any of our vaccinees who had this complication of blood clots. As far as we know, at least in PGH, we had about 4,100 recipients of AstraZeneca. None had any issue on blood clots.
All right. So, Doctor, what's going to happen to the second dose? Let's just say, for example, by May or June, when they arrive, we still don't know, what the effects are or what the recommendations will be. What happens to individuals like yourself who have already gotten half of the vaccination that they need?
That's going to be a dilemma because as far as a lot of people were saying, the scientists are saying there's really no studies on mixing vaccines. So if you get that vaccine, you should be completing it. So completion of the vaccination means usually 2 doses. So it's going to be a big problem if they say that AstraZeneca will not be given to less than 60 years old, because there will be a lot of people who will be missing their second dose. So I don't know yet the answer to that, Ria.
All right. So would they have to, for people who have gotten the first AstraZeneca, if there is no recommendation or it is no longer recommended or the 12 weeks lapses, does that mean they have to start over with a vaccine of another brand?
That's probably the next step that will happen, because you still need to vaccinate these people. And so if you cannot give the second dose of that same vaccine, then you have to go back to square one and do the vaccination for that specific vaccine.
As a recipient of the first dose of AstraZeneca, for you personally, Dr. Jonas, how do you feel about it? Are you worried?
I am actually confident that the AstraZeneca vaccine will be rolled out again. I think they're just really trying to be careful. The incidence of blood clots is it's quite low. No? In fact, when you look at it, one expert said that it's 100 times less than having a blood clot for people who are taking oral contraceptives.
Right. Okay. How is the situation in PGH right now, Doctor? Could you give us an update on numbers and how are your supply levels?
We have about 230 admitted patients for COVID out of our 250 beds. So that's close to a 90% occupancy. It's the same issue. The surge is still being felt. Our ICUs are full. We are getting sicker patients. They either go to the ER as walk-ins, even if we tell them that it has to be a coordinated transfer. And we also have a lot of patients waiting in other smaller hospitals who would like to transfer their patients. The problem that we have is our beds for the critically ill are full, and so it's so hard to admit these patients. So we also have converted some of our wards to to ICU settings because sometimes the patients get worse, and even though there's no ICU bed, then we have to put them on a ventilator in their own rooms. The issue of manpower is still there because the sick patients need not only just warm bodies, but you need experts to take care of them. Like you need intensivists or pulmonologists, specialized nurses, and sometimes we just don't have enough.
All right. So I know that the plan was to bring in healthcare professionals from other regions. May dumating na ba at least sa PGH?
Well, hindi po namin tinanggap yung galing sa ibang region dahil nahihiya po kami doon sa ibang ospital na mas nangangailangan. So, naging desisyon po ng PGH na mag-hire po kami. We were given the opportunity to hire. The DOH has granted some positions for temporary hiring. So, ganun po ginagawa namin. No? And those who are coming from the provinces, we said that ibigay na lang sa ibang ospital kasi mas nangangailangan sila. What we have been doing though is to close some of our non-COVID wards. So the manpower we get from that by freeing those beds, we transferred them to the COVID post. So we're doing some internal rearrangement.
All right. Thank you for your time this morning, PGH spokesperson, Dr. Jonas del Rosario. We always appreciate your time.